Thank you, everyone. Thank you, Ms. Kim, and thank you to the previous speaker about your great work on exosomes. Thank you very much. It's a very unique, small material, exosomes, right? And it was 4 years ago I discovered exosomes, and since then, it's revolutionized my clinical practice to a point that now every patient I treat them with exosomes. No matter what their age is, I think there is room for exosome treatments. We have or I have presented a lot globally in the last couple of years on exosomes, both human-derived exosomes, and now I have the pleasure to introduce also plant-derived exosomes from Mexico Bio. So as you can see from all over the world, the last 3 years has been dominated by exosome in every plastic surgery conference, every regenerative conference, and every dermatology conference. So this nanoparticle, it is amazing what the significance will be, not only in the aesthetic world, we are seeing it first, but also it will be revolutionary in therapeutics. Revolutionary in the next generation of chemotherapy drugs that will be manufactured, the next generation of drugs against Alzheimer's, Parkinson's, and in orthopedic use. So that's why we have to pay attention to the world of exosome. It has consumed my life, but in a good way. So in the press, since IMCAS Paris, we have had a lot of publications from the UK about exosomes, multiple journals, magazines, but also to the consumers, such as the Glossary, Harper's Bazaar, even Vogue, Harrods. Everyone is getting interested about exosome, and they are calling it the new frontier of beauty. And they're now establishing, recognizing the doctors and the clinics throughout London that are offering these treatments either in isolation or in combination with medical devices. And my phone didn't stop ringing since Kim Kardashian has had the exosome treatment in LA by a very famous plastic surgeon, and she had it in combination with Cyton laser. And the Daily Mail in the UK published this article, and then everyone, lots of consumers, lots of patients starting to ask about this new form of regenerative treatment. So I have been using exosomes for 3 years, and then to my pleasant surprise, when we went to visit Miss Kim last year in September, she told me that she was going to launch an exosome peel. So I thought, oh, wow, what an amazing thing, because, it will be the world's first peel derived from exosomes. And I was very thrilled to start using it and testing it on the European skin, but also for multiple skin conditions that have been covered by Professor before. So just sharing a few cases with you. So this lady, all the patients have used the Yes Peel, and most of them, I wanted to have an objective analysis so that I performed the peel only one session, and all the results are after 1 hour. And to see the reaction of the patient as well, and to the doctor's eyes, to have some consistency. So this lady is quite difficult because she's 64 years old. She's English, she's a 1-year post-chemotherapy for breast cancer, and as a result of the chemotherapy drugs, she sustained worsening of her skin laxity, pigmentation, worsening of the rosacea. And so she came to me and said, can you help me at all with my skin? So I thought, well, let me try the Yes Peel on her. And as you can see, we did the Yes Peel, and these are the results after 1 hour. So what we can see, there's a much better clarity of the skin. The redness is reduced, and also the areas of hyperpigmentation only after an hour. And she was feeling her skin. She said, it's amazing because it feels less sensitive. So this patient, she was very pleased, and we are continuing to have the multiple sessions. So that was the first case. The second case, this is a 49-year-old lady, and she is a clinic owner. I went to visit her in her clinic, and when I saw her, I said, wow, you're the perfect candidate for me to try Yes Peel on. She said, what is this Yes Peel? I said, our exosome peel. And she described to me that she was one day post having a severe systemic allergic reaction. She didn't know to what she had this reaction with, but as you can see, she is she's suffering from significant erythema. Her face was very tight, and she said her lips were swollen as well. So we perform one session of the Yes Peel, and this is immediately after an hour. And then we applied the Yes Cream after we took off the mask, and you can see the amazing result. So really, this has significantly reduced the redness to a degree, I would say that even I didn't expect it to be like this. And you can see after an hour. So these are, I think, for anyone who's practicing, phenomenal results. And under the complex case, this is a 34-year-old lady whose use, I couldn't believe it, 10 years of chronic use of tretinoin. She was self-medicating. She came to my clinic wanting anti-aging treatments, and she wanted me to perform a CO2 laser on her and some microneedling RF. And it's quite an interesting story because, first of all, I saw she had some redness, but I applied the topical local anesthetic. And when I took off the local anesthetic and was touching her face, actually she turned beetroot red. And I told her, you know, your skin is so sensitized by the tretinoin, I'm not going to do the device treatment because it is wrong, and I'm scared that I'm going to burn you. So then I changed the consultation, and I said, well, I have this amazing peel called the Yes Peel, and let's try. She said, no, I came here, and I have paid for CO2 laser and also all the sessions of microneedling RF. You are not going to talk me out of the device treatment. So with a lot of convincing, and she's very convinced that 10 years of tretinoin is amazing for her, and she says the sensitivity of her skin is throughout her entire body. Of course, because with such chronic use. And then we tried the Yes Peel, and this is one session, and after 4 weeks, and we can see how her skin has improved, and it's less red. And so now we're continuing the course, regular course of Yes Peel with, the hope of rebuilding her skin barrier and reducing the redness. Then this other case with someone suffering from mild degree of rosacea. She has been, she's been tanning in the sun, and she came back experiencing increased hypersensitivity. So we had 2 sessions, 2 weeks apart, and we can see quite clearly that the skin is calm and the rosacea is also less severe. Just some before and after. And then, because we were, sorry about that. Can you go back to just before the last slide? 24. Just before? Yes, 24. So because I gained some experience and some confidence in the Yes Peel, then I said, well, let me try to combine them when I am doing my microneedling RF treatments. So for this case, I have performed the Yes Peel first and then the microneedling RF treatment, and then applied also some exosomes, and you could see that I was pleasantly surprised that only after one session that the skin has improved quite significantly in terms of the pigmentation even, if we look around the eyes as well. and the clarity of the skin. So she was very pleased. So this is my very brief presentation on the Yes Peel, but every patient that we've tried the Yes Peel on, they've been very pleased. And even using the Yes Cream alone on its own is very good. For rosacea, for example, we represent the UK and Ireland, and Ireland actually has 99% of its population suffering from rosacea. So myself and Dr. Julia, we're gonna, you know, the Yes Peel is our target, and the Yes Cream for the Irish market and the British skin, because they suffer from a lot of rosacea and sensitivity. So we will report back at the next meeting how our progress will have been. So thank you very much.